Welcome to Adapting Class. Antiarrhythmic medications very important for the NCLEX and nursing school. Side effect is very key. If you know the side effect, very good. But you have to identify the medication, what is used for, and then you can answer questions associated with that. So I'm going to give you a crash course on that. Antiarrhythmic. First medication. Based on the name, arrhythmia. That means your heart is beating more than necessary, going faster, too much. So we want to slow it down. So the idea is to bring it back into normal sinus. And therefore, there's different kind of medication that you can use. Based on that, if you see a question and it said the patient has an arrhythmia, pick an answer choice that can slow down the heart rate. That's all, and bring the rhythm into sinus. Number one is sodium channel blockers. What are they? They have the last name as procainamide, right? They have mind or nines, right? Procainamide, lidocaine, right? Are specific medications that when you look at the name, they look weird, but these are the calcium and sodium channel blockers. Procainamide is the number one, or lidocaine. We use lidocaine all the time for local anesthesia, but it's an antiarrhythmia when the concentration is very high. What is used for atrial arrhythmias? That means your heart rate, your atrium is beating too fast, or your ventricle is beating too fast. Key side effect you're supposed to know: it can cause hypotension, it can cause QT prolongation. One of the medication you have to pay attention to is procainamide. It can give you like lupus-like symptoms. You get butterfly rash. It's a key NCLEX question or nursing school question. Procainamide, biggest side effect is a lupus-like syndrome, where you get butterfly rash, symptoms like you have lupus. Pay attention to that. This is the first class. So know the name, the class, what is the side effect? That's all. But their main function is to slow down the heart rate. The second group are beta blockers. Everybody know them. The law. They too will slow you down because they are anti-arrhythmia, but we don't call them like that. We use the antihypertensive, but actually they can slow you down. Very, very good medication, especially esmolol. Some of them are fast acting. They have the last name as law. Metoprolol, esmolol, propranolol. If you need more content on that, I have a bunch of video on that. But what is the main use? Atrial fibrillation, the same thing. Supraventricular tachycardia, that means you contact tachycardia that is above the ventricle. It's no atrial fibrillation, but it's different, right? As you can see, in this form, if you want an EKG, the atrial and then wave, the P wave is trying to and getting buried because there's no time for the T wave to finish. Atrial fibrillation, you don't have a P wave at all, right? So that's the difference between them. What is the side effect? Bradycardia. All of them will cause hypotension, bradycardia, hypotension. But the law, they can affect asthma, right? Especially they can cause bronchospasm. So you should avoid it in patients who have asthma and COPD. Should you avoid them completely? No. Look for the last name, BAM, BAM. B is bisoprolol, A atenolol, M and metoprolol. Those ones can be taken by patient with asthma. So if you have a beta blocker, look for the first name as BAM. Bisoprolol, atenolol, and metoprolol. They are acceptable in asthma patients because they are selective beta blockers. This one is potassium channel blockers. They block potassium. One of them is amiodarone or satolol. It looks like a beta blocker, but its main action is blocking potassium. What is used again? Atrioventricular arrhythmia. Number one, amiodarone. If you take it, you're going to be clone, P clone. You get pulmonary fibrosis. That's number one. That is number one. Apart from that, your liver function is going to go up, your pulmonary function is going to go up, your is going to go down, your TSH is going to go up or down. You get photosensitivity by P clone. Check my videos on adapting class. You get everything on. I have a single video on detail on amiodarone. But number one side effect is cough. If you see cough, that means they're going to die. That's lung pulmonary fibrosis, and you have to do something about it. That's your priority right there. The fourth one is calcium channel blockage. They're non-dippings now. Verapamil and the thiazide, they are not dipping. You have nifedipine, amlodipine. These ones are specific for antiarrhythmia. They're very, very good. We can use them in this situation. The same thing, atrial fibrillation, SVT. They all cause hypertension, bradycardia, and because it's a calcium channel blocker, it can cause constipation. The next group is the other one you can't figure out, but they can also be used as antiarrhythmic. Adenosine. This is specific for SVT, supraventricular tachycardia. What is the board going to ask you? Give it fast and push it so fast. In the few 1 to 2 seconds, it has to be. And you have to pick a vein close to the heart. And you have to flush it with 20 cc of saline. This is adenosine. You got to watch for flushing. You got to watch for their heart stopping. But this is very, very key. Adenosine is for SVT. Digoxin is another group for antiarrhythmia. We can use it for atrial fibrillation, but you should watch for other side effects. GI side effect is number one, cardiac toxicity, and other change in vision. But these are all class of arrhythmia, antiarrhythmia that you should know, so that when you see a question about AFib, ventricular tachycardia, which medication you can use, these are the group of class of medication. Very short crash course for you. So let's look at the question. The client in the emergency department is receiving lidocaine. You know it's the first group, right? For ventricular tachycardia. Which of the following finding will indicate that the medication is effective? The key word is effective. The buzzword is ventricular tachycardia. If you have ventricular tachycardia, you have a ventricular arrhythmia. I need to slow you down. If I slow you down, you come back to sinus. Don't worry about a heart rate of 110. Don't worry about decreased blood pressure. That's side effect. Don't worry about increased respiratory rate. What you should worry about is what? Heart rhythm coming back to its normal. So regular heart rhythm on the monitor. This is a concept I know a lot of people will pick. Decreased blood pressure. Question say effective. Effective means with using antiarrhythmia, we're bringing it from arrhythmia to a sinus rhythm. Thank you for joining Adapt NCLEX and watching this video. If you want more, subscribe down. You can see the link over there, or join our membership for content like that. Take care of yourself. Very cheap membership, and all the best of luck in your nursing school and at NCLEX. Bye.